for joining me on another episode of Oxygen Pharma. I am Marianne Keriakos, and today we will be discussing a controversial topic, the topic of personal protective equipment for pharmacists and the government's supply of PPEs to pharmacists, which is currently non-existent. And the reason being is that our Ministry of Health, Ontario's Ministry of Health, of course, is indicating that while pharmacists' services are valued, that the global supply chain for PPE is extremely strained. And of course, priority does go to hospitals and medical clinics, and rightly so. But as I quote the Minister of Health, another reason as to why these protective equipment or protective gear is not going to pharmacists is due, and I quote, to the fact that personal protective equipment is being prioritized for frontline workers who may experience exposure to members of the public who are symptomatic, end quote. This is a quote that was given to the CBC by the health minister's spokesperson. And they define experience exposure to close contact within 2 meters. And they're saying that pharmacists do not fit that description. I don't know what pharmacy the minister visited lately, but I've been to pharmacies where they don't measure 2 meters total. So I'm not sure what pharmacists are supposed to do then. And so today we'll be featuring 2 pharmacists who have 2 different positions concerning the provision of PPEs. Right now, pharmacists are getting PPEs from good doers and from private institutions and private organizations who are doing every effort to provide protective equipment to these pharmacists, but nothing from the government. So let's hear what the pharmacists have to say about this. And our first guest, hello, this is Teresa Maitri. She is a pharmacist who currently practices in the GTA. Hi, Teresa.
Hi, Marianne.
How are you doing?
Good, good. Thank you for having me today.
Well, thanks for taking the time to speak with us. I know that you must be very busy and exhausted. So,
Yes.
so as you just heard, so we're discussing PPEs and how the government is not really putting pharmacists on the list of people to be receiving the PPEs. And we, as we all understand that the protective equipment should go first to the doctors and the hospitals, and rightly so, but we want at a certain point for pharmacists to also be on that list. What do you have to say about that?
Yes, you are right. These days, we're facing a lot of challenges between serving the community and the public, and at the same time trying to minimize the risk of infection. We got an email from our college that they are engaging with the Ministry of Health to support us with the personal protective equipment. But as you said, nothing happened. We didn't receive anything. Of course, we're trying to get some from other suppliers, but I have in our pharmacy, very limited quantities that even though we are using the same mask for 1 day or more, of course, this is not right. But as long as I will be out of it, there will be they are unavailable everywhere.
Really? And how is the supply right now? Do you have enough to last you a week, 2?
Maybe yes, 1 or 2. I don't know what will happen next.
Yeah. And how do you feel going to work? I always wonder, as a pharmacist, I mean, how do you feel going to work without protective gear?
Of course, I'm afraid. It's uncomfortable. I'm afraid of getting the infection. I'm putting my family at risk. But at the same time, we are frontliners. We have to serve the community. I'm trying to take precautions as much as we can. But as you know, the government or the ministry advises as 2 meters apart from the patients. But this can't happen. Patients have to pick up medications, or even They sometimes request the receipt, so
Yeah.
I have sometimes to be in contact with them. So these 2 meters, it cannot be fulfilled.
Yeah, now I can
Some
understand.
other, yeah,
I mean,
sorry, go
I can
ahead.
understand that some pharmacies may be able to do it if they've got the space, right? But
Yes,
there are a lot of
yes, that's
small pharmacies out there in size, I mean, and how feasible is this?
That's right. You are right. Some pharmacies place the plexiglass barriers. Some others like put chairs or like
Yeah.
tables to prevent patients from coming.
At their own
But as
cost,
you said,
right?
if it's according to the space in the
Yeah, and
pharmacy.
it's
Yeah,
according to their own cost also. Yeah,
of course, and the owners.
and
Yeah,
as a pharmacist, so you are not a pharmacy owner, you are a pharmacist who works in the Greater Toronto area in a pharmacy. As a
yes,
pharmacist, I would imagine you don't actually have the choice as to whether or not to put the plexiglass. That is something that would be the choice of the owner of the pharmacy, correct?
correct. Yes, you are right. Yeah, yeah.
Thank you very much,
Uh,
Teresa.
you're
And you
you're
know, we
welcome. Thank you so much.
we really appreciate your service,
Thank you.
and hopefully the ministry will amend the definition of a pharmacist, because obviously you are in very close contact with patients who do have symptoms or who may have symptoms. So
Thank you so much. Stay safe and stay
you too.
healthy.
Thank you,
Thank
Teresa.
you.
Thanks for joining
Bye.
us.
Thanks.
Meanwhile, there are pharmacists and pharmacy owners across the GTA who are finding creative ways and means to protect their staff as well as themselves during this COVID-19 pandemic. One pharmacist is Mr. Sami Mikhail, who can be seen in this picture setting up a barrier of retractable belt stanchions in front of his dispensary. And Mr. Mikhail is joining us today via Skype. Hello, Mr. Mikhail, and thank you for joining us.
Thank you
Mr.
for having
Mikhail,
me.
you own a number of pharmacies across the GTA, and you've been practicing pharmacy for quite a number of years now. And so,
That's
on this
right.
episode, we're discussing the lack of supply of personal protective equipment to pharmacists by the government. What do you have to say about this and their lack of providing this equipment to the pharmacists?
I like to take a different approach. I don't want to overwhelm the government and put any added load on their shoulders. The government should focus on stocking the essential PPE equipment and supplies to hospitals in Ontario. Many doctors, including my son, who is an ICU doctor or physician, he said that they will run out supplies soon, in a month, probably. So I believe the government better focus on providing those supplies to the hospital. So the doctors and the nurses and the other healthcare provider in the hospital should be protected. The reason I'm saying that is pharmacists who have been in business for many years should have, hopefully, built enough connections with supplier to order and keep their shelves stocked with the PPE for their clients, their patients, and for their staff as well.
So, in your opinion, who should be then responsible for providing the pharmacists with this equipment, because it is in short supply everywhere, understandably so. Of course, hospitals should get first priority, but then who should be then responsible if the government is not doing it? Who should be responsible for providing this equipment to the pharmacists?
In a time of crisis like this, we all should stand shoulder to shoulder, pharmacists with the public, with their government. We need to stand side by side in order to go over and through this problem. I understand that buying groups and the management company that operates buying groups should take their responsibility and help to provide their members with enough PPE to stock their stores. Having said that, one of the leading banner management company uh, has already sent a communication to their members that an auto shipment will be received in their stores with gloves, masks, hand sanitizer, and extra, not for resale, but for the safety of the staff. I recently reached out to another pharmacist who is a leader on the pharmacy community and who initiate an initiative to acquire a stockpile of face masks in order to aid the supplies to local pharmacies. So I encourage those approach to relieve the load from the government and let the government focus on hospital and let the community pharmacy stand shoulder to shoulder next to each other, helping each other to find fair quantity for PPE for them, their staff, and for their patients. And I encourage all pharmacy buying group to follow suit and pay back to their members.
Thank you, Mr. Mikhail, for this point of view. And again, we very much appreciate all your efforts during this pandemic. And we hope that you keep safe. And thank you for joining us today.
Thank you for having me.
Mr. Sami Mikhail, owner of a number of pharmacies across the GTA. And I'd like to end this episode with a quote by Mr. Justin Bates, who's the CEO of the Ontario Pharmacists Association, who is quoted as saying, and I quote, "Pharmacists often see patients up to 12 times more than their doctors, and with many doctors' offices closed to all but emergency visits only, many patients are turning to their community pharmacist in this time of crisis." Well, if this is not an essential healthcare service on the front lines of this crisis, I don't know what is. Thanks for joining me, and until next time.